The duo is back.
SAM 25
There
in
you go.
Philly.
In Philly.
Rainy Philly.
Let's do a quick question. Let's jump
Yeah.
into it. We're going to still do some teaching here, right?
Yeah. So you have a 28-year-old female. She's coming into the ED with right lower quadrant pain, pelvic
Okay.
pain too.
Okay.
And it started suddenly. She's having vomiting, severe pain. You get an ultrasound, pelvic ultrasound, and it shows a large right ovarian cyst, about 5 centimeters or something. But it shows normal Doppler flow.
Good.
She's in a
Normal
lot of pain.
flow.
Yeah, exactly.
Normal
That's
flow.
great. Yeah.
Got it. I like it.
Normal Doppler flow.
Yeah.
What is your next best step here?
Yeah.
She's still in pain. Choice A, discharge home, outpatient OB follow-up. Choice B is going to be consult OB/GYN despite the normal Doppler.
Okay.
Choice C, give some pain control, reassess.
Yep.
Choice D, repeat the ultrasound in 6 hours.
Ooh, okay.
Now, correct answer is going to be choice B, consult OB immediately. So just because that ultrasound is negative, quotation marks, normal Doppler flow does not rule out an ovarian cyst with torsion. So this is the biggest thing here. Take it away.
I love it. You know, torsion really is a clinical diagnosis at the end of the day. And my thing with torsion is it is sudden onset, severe colicky. The times I've seen, you know, torsion, it's always like clinically, I knew it was torsion. If it wasn't a kidney stone, kidney stone is the one that will get you, right? It's either a kidney stone or it's torsion because it's that one-sided, you know. So always, anytime you have sudden onset, severe, you know, pain, that is key. That's why the history is so important. You can't really rely as much on imaging here, right? Imaging, honestly, I'm not looking for Doppler flow as much as I'm looking for a cyst, right? Because we know that most commonly, right, in women with cysts greater than 5 centimeters, especially, you know, on the right side, highest risk, right?
Yeah.
So, and early on, it's very intermittent, it's very painful. You have these waxing and waning symptoms, right?
This is a ballroom that we rented entirely for this podcast.
Yeah, right.
So thank you to SAM for giving us this whole ballroom.
Right.
A large donation from me and Board Bomb.
Right.
Hey, so the biggest things about ovarian cysts, and I tell residents and students this all the time, is that you're just not going to diagnose in the ED for ovarian torsion. What you're going to do is strongly suspect it. You're going to consult OB. And it's even easier if the ultrasound shows no blood flow. But it's a rare, often missed diagnosis. It's also a medical legal bomb, basically. Not a good type of Board Bomb. Right. So what you're going to do is you're going to consult OB, even if the Doppler flow is there. If the patient is having a lot of pain with a large cyst, go and consult them, and they're going to have to do the gold standard, which is laparoscopy.
Yeah, and a key thing too, in especially young females, like you know, you're talking about like adolescents and things. That cyst doesn't actually have to be like that big at all either, right?
Not at all.
So again, sudden onset, colicky pain, and that's the thing. I'll always ask my residents, I'm like, "What are you looking for on that ultrasound?" And often, I'm telling you,
always the Doppler flow.
It's always like, "Oh, the Doppler flow." I'm like, "No, that is not what I, you know, I'm looking for a cyst, right? Because I clinically know what's going on."